I wonder if Justin Bieber knows about that video. I'm sure he's doing Invisalign. Okay, now you saw one kind of so-called invisible technique. Marilena is now going to show us another kind of aesthetic kind of a treatment that I think you'll find very interesting, especially with the kind of patient that she treated. This technique requires a higher level of technical skill than some of the others do because of the kind of appliance that you're going to see. Marilena.
Hello, everybody. My name is Marilena Skyllouriotou, and I come from Cyprus, an island in the Eastern Mediterranean Sea, just 331 kilometers from Israel. Cyprus originally got its name from cuprum, which in Latin means copper. Back in the old time, Cyprus was famous for the copper deposits it had and export. What you see here is an image of the talantum, which was made from copper, and it's one of the first type of coins of that era. Most of you probably know Cyprus because of its beautiful beaches and coastal towns. But I live in Nicosia, which is the capital of Cyprus, and the last divided European capital since the invasion of the Turkish in 1974. Nicosia is one of the oldest cities in our part of the world. Today, it's a sophisticated and cosmopolitan place, rich in history and culture, and combines its historic past with the amenities of the modern city. The heart of the city, within the 16th century Venetian walls that have the shape of a star, has a number of interesting museums, art galleries, Byzantine churches, and a number of medieval and neoclassic buildings. The narrow streets retain the romantic atmosphere of the past. Much of the charm and the beauty of Nicosia is to be found in the old city with its labyrinth alleyways and elegant courtyard houses. Outside the walls, the new city with its modern facilities is a cosmopolitan center of a modern European capital. Here you can see the so-called buffer zone, patrolled by UN troops, the infamous Green Line, disrupting its cohesion and its continuity. This is how my journey to the world of dentistry began, from a simple visit 20 years ago. This is my father, who is also a dentist, my brother, a dentist as well. He's studying orthodontics, and that's me, believe it or not. Now let's go to our case. Ovid, a 22-year-old female, came to our clinic asking for orthodontic treatment. Her main complaint was, "I don't like my smile." She was concerned about her appearance during treatment because she presented frequently to audiences and wanted to maintain a professional image while getting a great smile. For that reason, she asked for an alternative orthodontic treatment other than the regular buccal braces. So, after we evaluated her needs, together with Dr. Geron, who was my instructor for this case, we decided that lingual orthodontic treatment was right for her and her lifestyle. Lingual technique is the most known as well as the most effective treatment modality of invisible orthodontics. The term lingual refers to the inside, tongue, or palate surface of the tooth. Lingual braces are attached to that inside surface, unlike traditional braces, which are fixed to the outside of the teeth. With the braces positioned on the inner surface, it makes them practically invisible and provides cosmetic orthodontic treatment without the destruction of typical braces. Lingual technique can provide the same great results as the buccal technique can. Nowadays, patient demand for aesthetic solution is driving lingual orthodontics to unprecedented popularity as people seek beautiful smiles, without the obvious appearance of metal or ceramic brackets. Now let's move back to the case. Ovid has a symmetric face with good aesthetic proportions and a full profile, which is normal for her ethnic type. What happened? So Ovid has a symmetric face with good aesthetic proportions and a full profile, which is normal for her ethnic type. During smiling, you can see exposure of upper and lower teeth and the malalignment mainly of the upper arch. From the intraoral photo, you see the tilting of 11, 12 is positioned palatally, and 33 blocked out buccally. The mandibular arch is asymmetric with severe anterior crowding. The maxillary arch is symmetric with anterior crowding of 4 to 5 millimeters and rotations mainly on the anterior part. The mandibular arch is asymmetric with severe anterior crowding of 8 to 9 millimeters, arrested caries on 36, and a bad temporary filling for 46. In the panorex, you can see the caries on 46 and the periapical lesion, and you can also see her nose piercing. Now, what we can say from the CEF is that he has a normal joint relation and that the problem is mainly dental due to the proclination of her upper incisors. Now, the treatment options for this case were the non-extraction option and the extraction option. Our treatment plan was to extract due to the severity of the crowding in the lower arch and the proclination of the incisors in the upper arch. We decided to extract 4 units. We decided to extract tooth number 15, 25, 35, and 46 due to its bad condition. Extracting for orthodontic purposes is a routine procedure. Approximately 20 to 25% of orthodontic cases are treated with extractions. And this is how the treatment began, by bonding the upper arch. You can see the lingual braces bonded in the inside, but we used STB lingual brackets for this case. Then we moved on to the bonding of the lower arch, and we also referred the patient for the extractions of the upper and lower teeth. After she did the extractions, we started leveling and aligning both arches using the extraction space to relieve the crowding. Then, when all the crowded was relieved, we started closing the residual extraction space. After all the extraction spaces were closed, we began doing final detailing. And then, finally, we achieved the desired result and we debonded. The patient was very happy with the final result. You can see the difference from the before and after. And at the beginning, she was ashamed of her appearance. Now she feels like a queen. You can even see how her eyes glow. The day that we did the debonding, Ovid said to me, "Thank you for giving me a reason to smile, and thank you for changing my life." And for me, it was the best present that a patient could even offer me and give me, because as you see, orthodontics is not only about straightening teeth. I was so pleased that I was able to change her life. And now, at this point, I would like to thank all of my instructors, the staff, Veret, Siam, and Daphna, my seniors, my brother and sisters from PG7, my juniors, my mother and father for their support. Mama, papa, αγαπώ σας πάρα πολλά. All my friends here in Israel that became my second family. Thank you for coming here. And of course, my brother, my little brother, who is now studying at the States, and unfortunately he couldn't make it here, for all his help for setting up this presentation. Thank you.